Well, November is Diabetes Awareness Month, and we continue our coverage tonight.
Yeah, today the American Diabetes Association held its annual event, State of Diabetes at North Carolina Central University. It's an opportunity to teach employers, healthcare professionals, and others about the risks and costs associated with diabetes here in North Carolina. It's also a chance to help people learn how to better manage the disease. I was honored to once again MC that event, and I'm also a member of the American Diabetes Association's leadership board here in North Carolina. Now, you probably have heard this before. Millions and millions of Americans are living with diabetes, and they do face potential for devastating consequences. African Americans are especially susceptible. Type 2 diabetes has devastating health effects, especially for African Americans. It causes heart disease, stroke, amputation, end-stage kidney disease, blindness, and death. Dr. Rachel W. Good is an expert in nutrition at the University of North Carolina at Chapel Hill Nutrition Research Institute. How much does this impact the African American community?
Yeah, diabetes impacts greatly. I think some of the challenges, what we know about, there's just disparate rates of, diagnosis of diabetes. So among Black Americans, they're diagnosed about 24% more frequently than other adults. And whenever they get diagnosed, they tend to have higher, complications and more severe, mortality.
And the death rate for Black Americans is higher than that 24% at nearly 40%.
So often what we see is that when Black Americans get type 2 diabetes, they might be on a trajectory to really have worsened impact of the disease.
Why is that?
Well, it's complicated. One thing we are learning is the social determinants of health play such a big part in risk for diabetes.
Those social detriments include poor access to healthy, fresh foods, food deserts, not enough areas for increased physical activity as well.
You may have high stress. You may have a lot of negative emotions that are constantly impacting you. You just have a lot of things that are getting in your way.
According to the Centers for Disease Control and Prevention, here in North Carolina, African Americans face significantly higher rates of diabetes, some 15.9% compared to 12.2% for non-Hispanic whites, and face higher mortality rates as well. Diabetes is the fourth leading cause of death for African Americans here in the state, a rate 2.7 times higher than for whites. Dr. Good's best advice? Like if there's one big thing to keep in mind.
Yeah, when your doctor tells you you have prediabetes, take it seriously. Take it seriously, because this is your opportunity to shift it. People can shift out of prediabetes back into normal glucose range very easily. But sometimes you hear it so much, you're like, oh, you're not paying attention. But this is your opportunity to take action before you actually are diagnosed with type 2 diabetes, and to begin to start learning, moving your body, thinking about what you're drinking, thinking about your vegetable intake.
And, we talk about this all the time. I've been pretty transparent about being diagnosed with type 2 diabetes a couple of years ago, and having volunteered for about a decade and a half with the Diabetes Association. I'm pretty much of a stickler, no pun intended, about checking my blood sugar. In fact, I just did it a few minutes ago.
Yeah, he does it during during breaks when the newscasts when he can, just to make sure it's...
To get in that window, So when you hear prediabetes, take that seriously, as the doctor said. By the way, if you'd like to, and I should say that my levels are back to normal.
Good.
Back in a good range right now. But if you'd like to learn more about diabetes, go to our website, cbs17.com, and look for this story online.
Good stuff.